Hello, everyone. Good day.
Good day,
Please
Mr.
welcome
Gbenga.
to
Uh,
you're welcome to the live podcast for Dialogue Chat Room. I want to say good afternoon to everyone. Um, it's a pleasure to be with you guys today once again. I'm your host. My name is Daini Oluwagbemiga, and this podcast will be co-hosted by Jerry, Dr. Jerry,
Hi,
Hakeem,
guys.
Invincible Genius, which is Dr. Ben, and also um, Miss Tolu Anime.
Hello, hello everyone.
So so today we are going to be talking basically about the COVID-19 vaccination, about the myth that has been circulating about around it. Can everybody hear me?
Your voice is
Can
a
you
Yes,
bit
I can
hear me?
hear
muffled,
you.
sir.
Okay. Yeah. So we're going to be talking about the COVID-19 vaccination and the myth that has been surrounding it. Um, I'm seeing here that Miss D and Y. There will be I will give you chance to call in later on in the show when we are taking questions from the listeners. Okay, so just bear with us now. So let me start with Mr. Jerry, Dr. Jerry. Dr. Jerry, how are you?
I'm fine. Good afternoon.
Could you just say a few words to our listeners today as a brief introduction?
Well, so today we'll be discussing, okay, not talking, discussing about the COVID-19 virus that has been, COVID-19 vaccine that has been put into circulation. But many people have been asking, is there a risk for it? Is it dangerous or anything? But today we are going to be discussing with ourselves the ups and downs of the vaccine process, okay?
Okay, Hakeem,
Yeah.
Hakeem, please say something to our listeners.
So first of all, I just want to thank you guys for tuning in, and hopefully we're able to, from this discussion, we're able to gain one or two things about this COVID-19 vaccine.
Okay, Dr. Ben.
Yeah, good afternoon, guys.
Good
Absolutely.
afternoon,
Hello?
sir.
Hello?
We can hear you, sir.
Go on.
Um,
We can hear
yeah,
you.
so thanks for tuning in, guys. We're going to be talking about COVID 19 vaccines, the side effects, and whether it's safe or not. So I hope you guys learn one or two things from it. Thanks for joining once again.
Yeah, and lastly, Miss Tolu Anini, could you just say a few words to our listeners tonight?
Okay, hello everyone. I'm also looking forward to this conversation. I mean, I've also had a lot, and well, for the record, I think I'll just be playing. Okay, the I think in conversations, I like to play the devil's advocate, so don't be surprised if I'll be asking a lot of questions. I'm not in the medical line, so I don't know about all the chemical components or whatever you guys will be talking about. I'm also open to learning from everyone
Yeah.
this evening. Yeah.
Okay, okay, that's good. That's good. Good to have you guys once again with us tonight. Um, I would like to start with a brief introduction into today's topic. We all know what the whole world has been suffering from or passing through the past 12, 13 months, the outbreak of the coronavirus, and how it has affected us in a very negative way, personally and worldwide. The pandemic has really, caused a lot of shifts in our daily routine as individuals and as a nation, as nations, and as the whole world generally. So, unfortunately, there has been a lot of misinformation surrounding the vaccine and its development. So, me, I myself, Dr. Jerry, Hakeem, and Dr. Ben, we are all in the medical field, and we decided to come use this podcast as an awareness to try to separate the myths surrounding this misinformation about the vaccine. We're trying to debunk the myths and tell you guys the facts about this vaccine. And I hope you guys will be able to learn one or two things and also spread the word. So people that are having this weird misconception about the vaccine will be able to have answers to their questions after this podcast. We'll be taking some questions later on, but right now I just want us to go into the topic of the day. So first of all, I'm going to start with the first question here. So someone sent in this question, and we're going to answer it now. The first question says, "Hello, I'm scared about this coronavirus vaccination. I feel it is unsafe because it was developed so quickly." That's the person's fear. That's person's question, and my answer will be that the vaccine actually, according to WHO and FDA approved guidelines, pass through all the necessary steps and process, just as every other vaccine have, meeting all safety standards. No steps were skipped. Also, we should also take this time out to thank all the unprecedented worldwide collaborators and investors that helped shorten the time frame of the development of these vaccines. The clinical trials and the safety reviews actually took about the same amount of time as other vaccines. So that's the answer to that question. I hope the person that sent that question in is listening. I hope that answers your question. The second question, which I'll be throwing to Jerry, will be is the vaccine safe? Is the vaccine safe, and what side effects can one expect from it?
Oh,
Well, if I can answer the question, like you said, well, the vaccine is safe because can anyone hear me?
Yes, we can hear
Yes.
you.
Okay. So the vaccine is safe because if it is not safe, it won't be approved by WHO or FDA. It went through the right steps or meant to go to. I think usually because vaccine takes 5 years or so, like to be able to go into circulation, but this kind of work faster because we're in a pandemic and we have a lot of i- instruments that can like we are improved the medical field now, so that helped us get it faster. And as for the side effects you can expect, I mean there are no long time side effects for the vaccine. Just have I think you have fatigue, which is normal with all vaccines usually. You have fatigue from it. That's the most common, or that's the most reported side effect people have said. And there are two doses, and I think the fatigue is more when you get the second dose. I read somewhere, I'm not sure about that. And then I think some people also presented with headaches, but after taking some painkillers that can go. And then the site of injection, like you can also get pain from site of injection, and maybe some chills. Well, but like I said, most of all the side effects are not long term. They're just like they're short term, and after a few days at most, you should be rid of the side effects. Well, I think the only danger or the most dangerous side effect is if you're allergic to any of the to any of the ingredients in the vaccine. But I think the most reported side effects people had to was polyethylene glycol, which is like one of the ingredients in the vaccine, and that's the most reported thing that people have been allergic to. But if you're allergic to it, they advise you to say before you take it. But if you don't know you're allergic and you take it, you're not allowed to take the second dose because I actually I meant to take the first one, then come back for the second dose some months or weeks later. So if by the first time you get an allergic reaction, you're advised not to take it second time. So yeah, the vaccine is safe. Just expect a few side effects, and yeah, I hope that helps somebody.
Oh, okay. Thank you, Jerry.
No problem. No
To
problem.
add to what Jerry said, we have we've been talking about the vaccine, but I just wanted to mention the types of the vaccines we have. The two major types right now that are in distribution around the US and in Europe are the Pfizer BioNTech vaccine and the Moderna vaccine. Both vaccines are mRNA vaccines. They are mRNA COVID-19 vaccines, and you would need two shots of these vaccines. Now, for the first one, which is the Pfizer BioNTech, if that's the one you're going to take, that's the one that is available in your region. The first shot is given um, the first shot is given on the first day, and then you wait for 3 weeks or 21 days after your first shot to get your second shot. And also for the Moderna, if that's the one that is available in your region, the Moderna vaccine, the first shot is given on the first day, and then the second shot is given 1 month or 28 days after your first shot. I hope that is clear enough. Now, Tolu said she had a question. Tolu,
Yes, to the first question asked,
yeah,
correct me if I'm wrong. I believe that's why we're here. Okay.
yeah,
So my
yeah,
concern is for a virus that is said to be to mutate. Okay.
yeah,
Like, have they gotten to the end? Like, I know studies are still ongoing. Have they
yeah,
been able to fine tune, accurately the operation or the modus of the virus for them to be able to bring out the vaccine that will accurately prevent it, or see to the end of it at the end of the day for a virus that mutates. I mean, I hope you understand what I'm trying to say. So
yes.
how safe, or how to what percentage are we supposed to trust this vaccine that is brought out so quickly to a virus that scientists are still trying to fine tune the way it operates and all? So that's just my question.
Okay, well, according to the FDA and according to WHO statistics, um, the report that was published by the researchers that actually looked into this vaccine said this vaccine, especially the Pfizer biotech vaccine, is 98% effective. The efficacy rate is 98%. That's how effective it is against the COVID-19 virus. But then the mutation or the mutant virus just started circulating briefly after the COVID-19 vaccine has been produced. Do you understand, Tolu? So
Okay.
basically, I cannot tell you right now if there will be a second vaccine or there will be a type of vaccine specific for that mutated variant of the virus. But right now, we're working with the one that has been spreading from the beginning of 2020 January till date before this mutated one occurred, because they're still doing studies on the mutated vaccine, right?
Exactly.
Exactly, yes. Sorry, not vaccine, virus, the mutated virus.
Virus, actually, the
Yes,
COVID-19
yes.
virus.
Jerry, you wanted to say something?
Yeah, based on how the vaccine was made, I think there's a chance this vaccine might work on the new variant, but it's not a sure thing yet because the vaccine is meant to attack there's something known as the spike protein in viruses. So the vaccine was made to attack the spike protein in the virus. So even though it's a new variant, it still has a particular it has the same spike protein as the others. So it might actually work, but the still in process to check if how effective it is. I don't know how effective it is, but I think it should be able to work. So
Okay. And just to add again, from the publication I have here, from the publication I'm reading from Medscape, and this is the publication from FDA during the clinical trials. They said both of the recently authorized COVID-19 vaccines are effective. The Pfizer BioNTech vaccine trial had 43,000 participants and had 95% efficacy, and the Moderna vaccine trial had 30,000 participants and 94.1% efficacy, which is a lot. If you're a researcher, you understand. Vaccine effectiveness was comparable across subgroups by age, gender, race, ethnicity, and underlying conditions. Several severe cases requiring hospitalization were avoided in vaccine recipients of both trials. Effectiveness in the 95% rate for a vaccine is exceptional. We don't have many vaccines with this kind of efficacy, so it is worth getting the shot. Um, so Tolu, does that answer your question?
Yeah. Oh,
Okay. Okay, so the second question here, I will throw it to Hakeem. The second question I will throw it to Hakeem. It says, how were these vaccines made so quickly? I don't trust them. So could you shed some light there, Hakeem?
Yeah, so the question is saying that how were the vaccines made so quickly?
Yes.
Uh,
How were the
uh,
vaccines made so
I
quickly?
actually understand that particular person's skepticism because when the vaccine first came out, like I think it was late last year, I was
Yeah,
thinking to myself that how is it possible that these people can just sharply develop a vaccine with in less than a year, when normally like vaccines take 3 to 5 years, maybe highest 2 years to develop. And at that point, if you can't still even say you can trust those vaccines that take that short time. But to answer the question, due to the technology that we have now, I think it was China that was able to sequence the genome of the virus as early as 2020 January. So once they sequenced the genome of the virus, it was easy for them to isolate certain parts of the virus that they can use to make this mRNA vaccine that we have now. And because of that, they were able to produce the vaccine faster. And also, due to the cooperation between the different countries and between the federal government and the private sector, that also went a long way in making the process faster too. So
okay. Thank you, Hakeem.
that's the
Thank you
answer
for
to that
that.
question.
Tolu, I have something to add to your question again, right? Just to clear any doubts, right? So you should
okay.
know that naturally viruses typically have mutations over time. You understand? They conform to the environment they are in, right? So
Okay.
now there have been two significant variants documented recently. One in the UK and the other one in South Africa. I think that's the mutated virus you're referring to. Now, though each of these viruses found have a number of mutations, the vaccine was designed to neutralize the entire spike protein. So the vaccine will probably still be effective. Do you understand? Now, studies are being done to specifically evaluate the efficacy of the vaccines against these variants. I hope that helps clears any other doubt. You know,
Oh, that places a lot of confidence on the
yeah,
vaccine. Actually, yes, it does.
yeah,
Thank
okay.
you.
All right. So I have another question here that I want that was sent in. Now, this one is basically something that I know a lot of people have been scared of. It says, I'm scared that the coronavirus COVID-19 in bracket vaccine will alter my DNA. I've heard it on the news, I've read it online. Is this true? Now, my answer will be the first vaccines that are granted emergency use authorization contains mRNA. Now, those vaccines we're referring to are the Pfizer BioNTech vaccine and also the Moderna vaccines, right? So they contain messenger RNA, which is called mRNA. Now, this messenger RNA instructs your cells to make the spike protein found on the new coronavirus. Now, when the immune system recognizes this protein, it builds an immune response by creating antibodies against the virus, teaching the body how to protect against future infection. The mRNA never enters the nucleus of the cell, which is where our DNA, our genetic material, is being kept. The body gets rid of this mRNA soon after it is finished using the instructions given to it. Okay, so the plain answer or the summary is no, it cannot alter your DNA, because I know a lot of myths have been out there saying, oh, don't take it, your DNA, you're gonna be a zombie but after you take the second dose. And then there are even memes that you see people after taking the corona vaccine, they're just moving weirdly to the tune of sound and all that. So all that is just a myth. I hope this helps clear that. So the next question, I'll throw it to Akim again. Akim, are you there?
Yeah, I'm here. I was just
Now,
laughing at the whole zombie
oh, yeah,
zombie.
you come across those memes too, right? Where they will tell you
Yeah.
after COVID-19 vaccine, and you see people tweeting and twitching, turning their necks and all that. And someone watching that and having this myth at the back of their mind will be scared that, oh, I'm not gonna take this vaccine because so and so can happen. So I just hope the person is listening to this, and it will help them actually like have confidence in the vaccine, in taking the vaccine. Now, the next question for you, Akim, is are there any long-term effects from the vaccine?
uh, Thank you very much for that question. Actually, there's no way to really know if there are any long-term effects for the vaccine right now because I think they just started giving the vaccine like October last year. Was it October or November? I'm not really sure.
November.
But
November.
but around late last year, so that's just like 3 months ago or something. So that's too short to know if there's any long-term side effects of the virus.
Okay.
So I guess we
Okay.
just have to like observe the people that have received the vaccine for now and see maybe like over a year or 2 years and see if they have any side effects. But right now, there's no way to know if they have any long-term side effects of the vaccine because it hasn't been around that long.
Okay. Okay. Um, Dr. Ben, just I know you've been quiet. I just wanted to say a few words so far about the vaccine. What's your take?
I mean, this vaccine, like like I've been hearing a lot about people not wanting to take it because of the side effect, and I mean, there is no vaccine that you will take that won't have a side effect. Most vaccines you take will have like side effect because it's like the actual whatever, like actual this thing that you're getting, but it's just like a mutated version of it, and everybody have different composition, like different body build up. So you you might have certain side effect like Dr. Jerry has
Yeah.
said, and
Yes.
but with this side effect, like it can be managed, and it's just like you can maybe the pain or you pain at the site of the injection, or maybe you
Yes.
have fever and some other things we can manage by taking some kind of medications,
Patients.
and
Yes.
yeah, you can be back on your feet after like 1 or 2 days. It's not something that will weigh you down and make you like not be able to do anything for the day.
Okay. Okay. Thank you, Dr. Ben. Thank you. Now, I have another very interesting question here, and this one, someone actually asked me when I was having a discussion last week with a patient at the hospital, and she said, I asked her, what do you think about the coronavirus vaccine? Is it not high time we start taking it so that um, everybody can return back to normal life? Which I know life can never be normal again, but at least a little bit of normalcy. And she said, I don't want to take it because it has a tracking device. They're going to be able to track me, so I don't want to take it. And now I want to just talk about that a little bit. Now there have been a series of videos that have been shared over time on Facebook, on YouTube, that makes made false claims about the products of the syringe maker called Appijet Systems of America. Now, this company has a contract with the government to provide medical grade injection devices for this vaccine, the COVID-19 vaccine. Now, the company has an optional version of its product that contains a microchip within the syringe label that helps providers confirm a vaccine dose's origin. The chip itself is not injected into the person getting the vaccine. So basically, it's the syringe that has the chip just for record purposes. not the vaccine itself. Do you understand?
Yup.
You don't get it?
Yeah, I get it. I
Hmm.
get it. I understand. Oh, yeah,
Serious.
go on.
Oh, okay. So I just want to throw a question out there to everyone. Do you guys think after we all get this vaccine, do you think life will return back to normal? Let me start from Dr. Ben. Dr. Ben, do you think life will return back to normal once everybody is
Uh,
vaccinated?
like if everybody's vaccinated,
Yes.
I mean, I feel so.
Okay.
Yeah.
You, what's your percentage of normalcy that you think it will, like, will have?
I mean, based on what on the percentage of the efficacy. I
Yeah.
mean, like if everybody is going to be vaccinated, I mean, I feel like life should go back to normal. Because if you remember, like when polio was paramount, like in was
Polio.
people were being infected with polio and everything, like it got eradicated because like people were vaccinated and stuff.
Yeah.
And for that to happen, you have to vaccinate like almost like a large percentage of people. So I feel
Yeah.
like if the efficacy, if the based on the percentage of the efficacy, if
Yeah.
everybody's vaccinated, like we should be good.
Okay. Okay. Hakeem, what's your
Mm-hmm.
take?
First of all, let me start by saying that we as a human race, I think sometimes we tend to underestimate ourselves because if you look at from since when we started recording human history, we've overcome a
Okay.
lot of obstacles, and
Okay.
coronavirus is just one of them. And very soon we'll return back to normal. So 100% normalcy. That's what I'm going for.
100% normalcy.
Yeah.
Okay. Dr. Jerry,
Yes, sir.
do you
I'm
think we'll
happy.
be 100% back to normal?
I'm happy you called me last cause well, I think we should be between 80 and 85%. Okay, let me say 90% normalcy, even with the
90,
vaccine, even with the vaccine. And I
90.
say that, yeah, 90%, about 90% of normalcy. And I say that because I have the flu in mind. Because now people get the flu, people have the flu shot every year. They take the flu shot every year. But
Yeah.
we still have people that get the flu from time to time. Okay, so
That's
I think having the COVID vaccine around will be something like that. Not many people will be having it. Even when they do, it will be very treatable as
treatable.
just like the
Okay.
flu. But I don't think we'll get 100%.
Okay.
90%. Okay, let me be generous and say 95%. Let me say
Okay.
95%. And I think that's good enough.
Dr. Jerry, what's the difference between what you said now and what I said?
You said
95% to 100%.
you said
What's
hundred
the
percent. We
difference?
cannot get 100% normalcy. I'm sorry.
Okay,
Well,
so
five.
what do you think? What are the specific changes you think will happen? Is it that like
Well,
we'll keep on taking the the vaccine
vaccine.
yearly, like the influenza
Yeah,
vaccine?
yeah. It might be I think it might have to be something like that actually, because it's not a one time. It's not a one time shot that goes on for lifetime. I think you're going to have to get new ones from time.
Yeah, yeah.
Maybe not yearly. Could be every 2, every 3 years, but you're going to be like I said, like the flu shots. And
Yeah,
even if go on, sir, go
okay.
on.
Yeah, I agree with Dr. Jerry because remember, like I think there are different variants of this COVID-19. If you and like Dr. Jerry is saying like flu, the influenza virus, like you have different variants, and that's why they like you have to come up with different what they call it vaccine to
Vaccines.
give every year. I don't know what I you
Yeah.
understand
Yeah.
what I'm making
Yeah.
Yes,
sense.
Like
yes,
influenza. I
yes,
think.
yes.
Yeah. BC Day was saying right now. I agree. I think it's going to be around like the flu. So I think what she's trying to say is that the way we take the flu shots every year or every 2, 3
Exactly,
years, yeah, the
exactly.
COVID-19 vaccine too is part of the vaccinations we need. You know, the way we take hepatitis and all that. Okay.
Exactly.
Tolu Anime, Miss Tolu Anime.
Yes, I'm still here.
Yeah. So could you what do you think? Would there be normalcy? Restored how many percentage?
Well, I tell my friends that I don't think there is anything like going back to normal. Like we are all moving forward, so it's just definitely going to be a new normal.
Yeah.
It's almost like 1980, 1919 again, like influenza. So my friend was telling me it's going to be like that flu. It's going to be like a common flu at the end of the day, and you start we could treat and you get the vaccine and all that. So, but
Okay.
I don't think there's going back. There is no going back. We are all moving forward. We are all progressing, globally. So it's just going to be a new normal for everybody. Lifestyle will change. Work etiquette will change. A lot of things have already changed due to this COVID virus. So just moving
Oh,
forward, actually, yes, that's what I think.
oh, okay. So, I have a question in the chat box here. Someone is asking, have you discussed on if it will alter the DNA? Yes, we have, but let me go through it again because I think people are just joining us and they need to hear it again. Now the COVID-19 vaccine, right? it it contains the vaccines that we're talking about are the Pfizer BioNTech vaccine and the Moderna vaccine. They are two separate companies and they contain the mRNA protein. Now, what does the mRNA do? The mRNA is a messenger RNA which instructs cells to make the spike protein found on the coronavirus um, itself. Now, when the immune system recognizes this protein, it builds up an immune response by creating antibodies, thereby teaching the body how to protect against future infections. Now, this mRNA never enters the nucleus of the cell in your body, so which is where our DNA, our genetic material is being kept. It never enters into the nucleus. It can't enter into the nucleus of the cell. So the body gets rid of this mRNA as soon as it's finished using the instructions given to it. So no, it does not alter DNA. It cannot alter your DNA. I hope that answers your question. BC Day. I hope that answers your question. So I have other questions here, which I'll just be going through very fast because of our time. Now this one says, I'm scared. I read somewhere in an article that COVID-19 vaccine causes infertility in women. How true is this? And my answer is false. Yes, the truth is that there has been a publication or a research that went into it, and it was published that the vaccine has an amino acid sequence which is shared between the spike protein and a placenta protein. That's if a pregnant woman gets it,
Yeah.
or someone that wants to conceive. But however, the expert says that it's too short to trigger an immune response and therefore doesn't affect fertility. So there's no information, there's no data corresponding to it causing infertility in anybody, women or men. Now, there's another one that says, I have already been diagnosed with COVID-19, so I don't think I need to receive the vaccine. One thing I will tell this person that wrote this was is that if you already contracted the vaccine, the COVID-19 virus, now there's evidence that you can still benefit from the vaccine. Now, at this time, experts don't know how long someone is protected from getting sick again because, as Hakeem said, the vaccine was just started distributing by November last year, so it's still very short time. They're still monitoring it, so there's no particular time frame for you to be able to say, "Oh, I'm protected for life" or "I'm protected for a year." So now experts don't know how long someone is protected from getting sick again after recovering from COVID-19. The immunity someone gains from having an infection is called the natural immunity. Now, this varies from person to person, as Dr. Ben said. Some early evidence suggests natural immunity may not last very long. So it's best you get the vaccine because vaccine gives you humoral immunity. So you have two in one, basically. Now, another question here says, once I receive the COVID-19 vaccine, I'm no longer going to wear my mask. Thank God. Now, I would like to answer this question and say, wearing your mask, washing your hands, sanitizing, and physical distancing will still remain a necessary precaution until a sufficient number of people are immune or are proven immune. That means until almost half the world have taken vaccination, or almost everybody in your area or in your region have taken vaccination. Because the best way to protect yourself right now is just to follow the current guidelines. You understand? Because right now, at the beginning of the show, we were talking about the mutated strains being seen right now. You understand? And they're still studying how to develop vaccines for those ones. You wouldn't want to still, because of your negligence, go and get infected again and go through all the cycle and all the symptoms and all that again. You understand? So it's just best you follow the necessary guidelines and let the public health experts update us on what to do with the mask wearing and stuff. So for now, let's just keep wearing a mask, maintain physical social distancing, use your sanitizer, wash your hands regularly. Now, the last question here, before I take any questions from any other person and we wrap up, will be once I receive this vaccine, I am scared I will test positive for COVID-19. Now, well, this is false because viral tests used to diagnose COVID-19 check samples from the respiratory system for which the presence of virus that causes the COVID-19 resides, right? So now, since there is no live virus in the vaccine cannot affect your test result, meaning you won't test positive if you have the vaccine because there's no live virus in the vaccine. It is possible to get infected with the virus before you are vaccinated or before the vaccine has had time to fully protect your body, but the vaccine itself does not cause infection. So I hope that clears that up, and I hope the person that sent me this question right now is listening to it. So I want to throw this on the floor. Any questions, any suggestions, any comments? The listeners can start calling in now. Just you hit the calling button, and I will let you through on top of your device. If you're using the app, if you're using a laptop, it's by the side on the right side of your window. But let me throw it to the co-hosts. Dr. Ben, any suggestions, any questions, any feedback?
No, not at the moment.
Not so far. Is it clear?
Just to add to what that question that the person that already had COVID asked.
Yes, yes,
So there has actually been reported cases of people that had COVID in the past reporting with new cases of COVID.
yeah.
So I think it would be wise to just take the vaccine because
Okay,
at this point we don't really know much about the virus. We know a lot, but we can still know more.
yeah. Okay. Jerry, Dr.
Yes,
Jerry,
sir.
any anything you want to add? Any questions? Any suggestions?
Let me see. Well, maybe I don't know who needs to hear this, but everything will go back to normal if we just like maintain our physical distancing, sanitize our hand. Cause for the whole pandemic thing to be over, I think they said there has to be no reported case for 14 days straight. Or is it 14 days or 21 days? I'm not sure.
Think
Like
so too.
there has to be no new case reported
Yes.
in 14 consecutive days. So for that to happen, guys, we have to wear our masks, wear our like wash our hands regularly. These are basic things we should be doing. And then people need to
Exactly.
understand that the vaccine is not a cure. It prevents you from getting it. It doesn't cure you from when you get it. It prevents you from getting it. I think that's a common misconception amongst people. It is not a
Yes.
cure. It's just to prevent you from getting it. That's to
Okay.
answer the person that said something about having the virus and don't it. You should get the
Oh,
vaccine to help yourself if you are
okay.
listening.
Okay. Okay, that's good. Mr. Luanimi,
Yes, sir.
so what's your take? What any suggestion? Are your questions have the questions been answered? Do you strongly believe that you need to take the COVID-19 vaccine now, or you still have your doubt?
Well, I would just like to say this. there's always a reason why some news will always make headline. Like they say, there's always an element of truth out of every lie. So I could understand why people are so agitated and should I say, cautious about this whole COVID-19 virus and vaccine and how the whole thing is just going. We've seen a lot of viruses come and go. We've seen a lot of diseases come and go, but there's just something strange about this COVID-19, especially how it seems to be like world powers. There's China, there's US, and it seems to be like something else is going on underneath, and people are not understanding what's going on. So yeah, myths will start to come out, but I don't think it's enough reason for you to throw caution into the wind. Yes, better to be safe than sorry. Actually, take the vaccine, and but also I think it's just safe for everyone to be at alert. I'm
That's
just playing with devil's advocate here, so it
yeah.
it just seems to be like a lot of political things going on. Also, you wouldn't want to deny that, but then, well, what can we do? So we just have to do what we can to keep ourselves safe and healthy, I
If,
guess.
if I can
Okay.
add to what has been said, this whole vaccine thing is just, I think the whole question and like the whole problem we have now is because this is just like beginning stages of getting it. Like they just started, the first vaccine was given when like I was very recent. So I think within 6 months, everybody will really see what the vaccine really does. So I guess with time
It
and
does exactly.
patience, we should know what we are getting into. But I really think it's better to be safe than to be sorry later. So why not?
Okay. Anyone from the audience? Anyone have any additions, any subtraction, any doubts you want us to address? Any questions? You can type it in. You can call in if you have any questions. Let's just give them 1 minute. Oh, we see that you can type in if you don't get through calling in. You can type in too. While we're waiting for them, Dr. Ben, how is the situation in your side? How is the COVID-19 situation in your side?
People don't care anymore.
People don't care anymore.
Yeah, man.
That seems to be the new normal. That seems to be the new normal. No one cares anymore. Like
Yeah.
Like
everybody's
it's so
tired.
it's so it's so funny because when the pandemic first started, people were very cautious and wearing their mask, sanitizing, all those things. But right now, like people don't even care anymore. Like the cases are increasing and still people don't even care. Like if I get it, I get it. Like I mean,
I I think that's because this whole COVID-19 virus thing. I think because it's playing on people, like on people, you have to depend on that people for you to be safe. That's why it is worse now. Because if another person does not sanitize and then touches you, even though you are safe, you are not in danger because of one simple person, and that's not your fault. So I think that's why it is. And now nobody cares about the other person, and everybody just doing their thing, and that's just not. That
Every
doesn't
every
bode
man
well
for
for us
himself.
going forward. I'm telling you, everybody's at war, and they say everything is fair in love and war.
Oh,
So someone just typed in here and said, "I am now at rest and will take the vaccine with no reservations." I think the person deserves a round of applause. Well, I guess if one person could change our mind or could actually be convinced through this podcast, then I think we've done a great job.
Yeah.
Because this is, I know a lot of people will still have their doubts, but I think we should, as people that have been part of this podcast today and you have the knowledge about it, spread the word to people. If you find any of your friends having doubts, this podcast will be published on YouTube, iTunes, Spotify, and Podbean. So you could share it on your status, on your WhatsApp, on your Facebook page, so people can listen to it, have necessary information, and I would also like you to tell you that we have other segments we do. Almost every 2 3 days we'll be having different segments. We just have conversations among us as friends, and we talk about everything pertaining to us. Things literally that people don't want to talk about, we talk about it here. This chat room is a safe room for everyone. You can come in here and share your thoughts. You're practically anonymous. It's not a video call or anything. So you could call in, give us your story. We could talk to you. We could advise you. You could advise us. Pertaining on the topic for the day. Every day we have topics, and also we have a YouTube channel. We would like you to subscribe. The handle is called the Dialogue Chat Room. Dialogue Chat Room YouTube channel is on YouTube, and you could subscribe there. We used to post our podcast. In case you miss any of our podcasts, you will find them on that YouTube channel. And so I think at this time, this is the end of the show. I would like to thank everyone for joining us and hope you join us again next time. We'll be having a premiere show on the 28th of January, which is Thursday, this coming Thursday. We'll be talking about a lot of things, from relationships to politics to all that. So you could join in, and it's gonna be fun. Looking forward to seeing you guys once again. Have a nice night. Good night.
Good night.
Good night.